Rebecca. We're now back in session. We're going to move up to the county administrator monthly report. We'll also include the governor's Evers executive order under that same report.
Again, the monthly report is in your packet, just for reference in terms of, I guess, major activities on our larger projects. If there's any questions, I can take that. If not, I will move on to our, I guess, our COVID report. I'm also going to, I guess, include the resolution of 2020-19, the declaration of the state of emergency, because it relates to our activities related to COVID. Just in terms of what I did is we have that on the agenda each month, just so, well, one, that we're aware that we're still under, I guess, what we considered our declaration of the emergency. But we're also just monitoring the state of, how long do we keep it on the books or how long do we keep on operating under that. And I asked Dan Kane, he will be online and you can also verify that. But in general, right now, most of the counties or communities that have it still have it on the books or still have it in, I guess, in operation. And the main reason really is before any type of assistance we want to get through FEMA or reimbursements we want to get through FEMA, we need to have that, I guess, on the books and operational. So both from Dan's standpoint and also mine, I guess I'm recommending that we still stay under the declaration of the emergency. And again, that's something that we can look at each month and review as a county board. I can tell you that we have not done anything out of the ordinary in terms of, I guess, policy or expenditures or anything that I would consider out of the ordinary. And again, a lot of the things now that we are trying to accomplish, we're trying to get down to the home committee level whenever possible, if the timing works. But I think for the most part, we have not made any major decisions or anything that, I guess, when we usually come back and get authorization from the county board of a decision that David and I made in terms of concurrence, we have not done that for probably over a month and a half in terms of anything we have to do. So the main point is I think we should leave it on or stay under the state of emergency at this point in time. But again, we'll keep on putting it on the county board agenda and we can have that discussion each month to determine where we're at. In terms of other updates, I know both Dan and Sue are online. Maybe Dan, I'll unmute you first if you could provide an update. Dan Kane, you have the floor.
Good morning, everyone. Dan Kane, Emergency Management here. I guess I'm just going to give you a brief overview, 10,000 foot of statewide activity related to COVID. The month of September is best categorized as exponential growth in terms of numbers and infection rates. Beginning of the month, our average cases per day was 842. We are now up to 1,792 cases per day on average since the beginning of that. Positivity rate similar. Beginning of the month was at 11.3%. We are now up to 16.4%. Positivity rate recovered. We are just over 18,000 cases recovered since the beginning of the month. That represents about 85% of the total cases in the state of Wisconsin, which would then mean that our active cases represent about 14% of the total cases at a number of 14,414 active cases. That is up 7,000 cases from the beginning of the month. Wisconsin Department of Health Services does categorize every county in a COVID activity level. You guys have heard this quite a bit. Every county in the state is classified as a high, except for Price County. They are at a medium. The Wisconsin Department of Health Services is planning on creating a very high category, as we are finding that that level is going to be needed to differentiate, as there are some counties in that very high, or what they're calling a critical level. Quickly on testing, still working with public health, the hospital, and other partners to determine locally if we think another mass testing site is needed. No other updates on that. And turning our attention a little bit towards flu season and vaccination plans, looking at working with public health to put together a drive-through flu clinic and planning around that, as well as taking some lessons learned from that to help us prepare for COVID vaccine planning when that comes available. And I will mention lastly that we are starting to see a lot in the national media and some in the local media around vaccination for COVID. I would just urge everyone to not read too deep into what you're hearing. You're getting quite a bit of confusion and discrepancy at different levels of government on when that might come about. We don't have any, we still don't have any real major updates on that, but it does look more and more like it could be a two-staged vaccine. But in terms of dates, we're hearing everything from next month to second or third quarter next year, and it's going to be rolled out in stages. So more to come on that, but just starting to get into that conversation nationally and at the media. Just wanted to make you aware of that. So if you have any questions, I'll be happy to take those. Otherwise, that's all I have.
Thank you, Dan. Any questions?
Thank you. Dan, do you have any specifics on the drive-through clinic and asymptomatic community testing? Or the drive-through testing that was done to the fairgrounds?
Do I have the positive numbers and the numbers?
I just haven't seen any follow-up reporting on it. Yeah. So is that information available, or what was the results of that?
Yeah, it was about 550 tests completed, right in that ballpark, and only about 3 or 4 positive cases out of that.
Thank you.
Vinny, did you have a question?
Yeah, the question I have is about the critical level. If there's any information about, you kind of have an idea of, community responses to a high level, but I'm just trying to understand what would create a critical level and how that would maybe change what the response would be.
It was a little hard to hear. If I understood it right, it was difference between high and very high.
Just the critical level, you said they might are looking at having a need for. Do they have any information about how that would be different in your community planning versus a high level? I know that's something that schools are really looking at, but just any more information on what a critical level would mean.
I have not heard anything. If Sue has anything in her brief, she can mention it, but they haven't. Again, they're just looking at creating this category right now. Once they do create it, I'm hoping to learn more about it and what the differences would be.
Thank you.
Susan?
I apologize if you said this and I missed it in listening to your numbers, but did you talk about hospitalizations statewide and whether our hospitals anywhere are getting overwhelmed? I
did not, but I can touch on it. I can tell you, referencing the Badger bounce back criteria, 100% of hospitals continue to report not needing to operate under crisis standards of care, which means that they have enough space, enough people, and resources to handle it. Whether or not that's going to continue remains to be seen, but under Badger bounce back, that's what we're seeing. And I can tell you real quick, in terms of hospitalization rates, they are starting to see an increase statewide. I can get you an actual number here. It is at, as of today, apologize, spinning. We are at, come on, 6.5% of people who've had the disease have ever been hospitalized. Currently, about 6,700 total people were ever hospitalized. So that's up from about 3% roughly since probably the beginning of the month. So I've been tracking it.
Thank you.
Any other questions for Dan? Thank you, Dan.
Thank you all.
Okay, I will go to Sue.
Good morning, everybody. This is Sue Powers, Public Health Manager and Health Officer. I'm going to first ask if you can hear me okay.
Yes, we can hear you.
Awesome. So, as I'm sure you've noticed, things have changed quite a bit in the last month as far as COVID activity. The activity, as Dan described, remains high in our county and as well as across the state. And I'll just explain a little bit more about the picture of that, what we're seeing. In July and August, in our jobs, we had about 1 to 4 cases daily, and now we're seeing 5 to 12 daily. And this morning we got to the office and there were 16 cases waiting for us. So far, there have been over 100 new cases in September, whereas in July we had 41, in August we had 49 for Door County. The good news in all of this is that the majority of the cases, symptoms are mild. Very few hospitalizations. So cumulatively, since the beginning of the pandemic, for Door County residents, there's been 13 hospitalizations, and we remain at 3 deaths. As far as age groups, we've had a few more cases of children recently, and the actual numbers will follow at the end of the month with our totals, as we did last month. Much as I described a month ago, people are moving about more, gathering more. Weddings, private parties, reunions. We are seeing cases spread in workplaces, long-term care facilities. There's often household spread. And there have been some cases in students and staff at our K through 12 schools. There are still a fair amount of cases who have no idea where they could have come in contact with COVID. And that speaks to the high amount of community spread. People are asking me, don't masks work? Didn't the mask mandate work? From the reports we get in our conversations with people we follow up with, I've concluded that masks only are effective when you wear them. So the people attending these private gatherings typically do not wear masks, and there seems to be some sort of a misconception or an unwillingness to believe that when you're gathered with people you know well, that there could be any risk. We're hearing stories about small groups of intelligent, educated people gathering, doing things like eating together, which allows spread. That's just one of the typical scenarios. So the situation at present, please know, if you're out in public, we should all expect that we will encounter the COVID virus and adjust our actions to prevent contracting the virus. And as Dan said, there's been a surge in cases statewide, associated also with colleges resuming and K through 12 schools, and the end of summer activities like Labor Day and travel. And really, I think Dan said exponential growth, and that's what we're seeing. I mean, if one case creates 3 cases, and then those 3 cases each create 3, you can understand how quickly it can spread. And it just seems to have gotten to a point where it's taken off. So our priority at public health remains to follow up with each case in a timely manner. To keep our community as safe as possible, we're continuing our 7 days a week working. We do have 4 new contact tracers on board, each working 24 to 32 hours a week. And we want to ensure isolation of positive cases and contact tracing to ensure quarantine of close contacts. The state has set a parameter for asking us to follow up with each positive case in 24 hours. And obviously that's what we want to do. And we also want to follow up with their close contacts per the state parameter of 48 hours after that. And as of last week, we are no longer able to accomplish that. And the situation I'm describing and the inability to get to all these cases in a timely manner is similar to what other local health departments are experiencing, not just across our region, but the state. And at the state level, there is a contact tracing team to support local efforts. We can refer our cases. At this point, they're backlogged about the same as we are, about 3 days at this point. But we have begun to refer our cases there. Last Friday, there was a backlog, for example, of 2,700 cases in the state contact tracing team queue, and they have 200 contact tracers. So since the start of school, we've had a number of situations in which we work closely with our school district, following up on cases. We continue to meet with them regularly and work together with them. We are also working with long-term care facilities, businesses, and there are a number of challenges we're experiencing. And one of those is we are simply not able to answer our phones as quickly as these folks would like and attend to their questions and their situations as quickly as we would like. In individual cases, many people are cooperative and really concerned about preventing spread. And then there's others who refuse to quarantine, don't want to cooperate with identifying close contacts, and simply say they need to go to work. There are certainly huge challenges in asking people to quarantine for 2 weeks. And this has really been amplified with the cases in the schools because of school kids having to quarantine. More parents have needed to stay home with their children, and obviously this is a huge strain on families. The United Way and other agencies in our community have stepped up to support families, and I feel this is going to be a continuing and growing need in our community. There's an aspect to the pandemic in the last couple of weeks that's been such a huge concern, and I'm sure you've noticed it too, that it nearly overshadows the actual virus. And I'm talking about the anxiety, the frustration, the fear, the lack of patience, the, in general, emotional response to COVID. The number of calls at public health has gone up every week. And this morning, when I met with my team, the reception staff let me know that yesterday we had a week's worth of calls. And people are impatient and rude and have complaints. Contact tracing efforts are diminished, as I said earlier, by lack of cooperation. Community partners we work with, other professionals are stressed as well, causing strain. What we're observing is that our community is collectively fatigued, frustrated, anxious. One of my staff said the other day, because COVID is invisible, people are yelling at us. And respectfully, I would ask you as important community leaders to please help us all take a deep breath and continue our unified approach to mitigating the effects of this virus. Last week in a communicable disease webinar, Governor Evers addressed public health collectively. And he said, public health is a team sport. And the first thing I thought of was, yeah, our cooperative work with the state DHS and epidemiologists and other local health departments. And then I thought about it a little more, and I realized, you know, all of you as community leaders and our business partners, healthcare partners, school administrators, actually everyone is a member of the public health team at this sport, and not everyone wanted to be on the roster. But that's the situation. We really are all part of this. And there's no one simple solution. Using all the tools we have is what's going to work best. And as Dan has alluded to, the state has asked us to prepare our plans for vaccine distribution and given us some information about priority groups and how that's likely to roll out. Vaccine date is unknown. Our work with the flu clinics this fall will be practice for us for distribution later of the COVID vaccine. What we know about vaccines is that no vaccine is 100%, and we will need to continue the other measures even after a vaccine is available. For the short term, it would appear that the disease rate is going to continue as people continue to move about, congregate, And then as the weather cools, we'll be moving indoors where COVID is more easily to spread, depending on ventilation. Better ventilation, less risk. We're going to have fall travelers both coming to our county and Door County residents traveling out of the county and back. All this encourages viral transmission. With COVID, safety in numbers does not work. As a tourist destination, that poses more of a risk, and with a large elderly population, they're more at risk. Masks are going to remain a very important tool to prevent spread. Credible science experts agree that masks are an important tool. So the tools we have are masking, distancing, hand washing. As far as testing, our healthcare partners have not been able to keep up with demands for testing in the last week or so. DCMC does most of the testing for Door County. The Aurora Clinic in Sturgeon Bay at their urgent care will do testing of symptomatic people. The last I heard, Bellin Clinic in Sturgeon Bay is hoping to offer testing soon. I'm maybe a few days or a week behind on news of that. So if they're up and running, I'm not aware of it. So that's the situation as it looks to us, and that's my report. I would be happy to take any questions.
Thank you, Sue. Got some questions. Megan?
Thank you. I first have a comment and then a question. The comment is one thing that I'm continuously wowed by is that COVID has become politicized and that public health has become politicized. And I think that that's something that as government officials and out in our communities that we can really help to mitigate that. Public health is not something that, health in general is not something that follows any sort of party lines. So I think that that's a really important piece to this, especially in our community. I'm running into that a lot. So that's my comment. My question, Sue, is if you can elaborate a little bit. One thing that stood out for me at our Health and Human Services meeting was a comment that Dr. Heiss made in regards to lessening viral load by the wearing of masks. There's a lot of folks in our community that have been saying, oh, well, you know, there's a bunch of asymptomatic folks or symptoms are lower and not as severe. So this really isn't a big deal at all. We shouldn't be paying attention to it. And one of the points that Dr. Heiss made was that the wearing of masks actually lessens the viral load that's received with the transmission. Can you expound on that a little bit?
Yeah, sure. Thank you, Megan, for bringing that up. And first of all, I just have to say, yes, we've had milder cases, and we don't know all the reasons for that. And we can't predict whether there will be, a surge in more severe cases. And it also depends on one's general state of health, as with other illnesses. What kind of severity you're going to experience does relate to one's individual health. So Dr. Heiss commented about people talking about that masks are not 100% effective. They're fabric. Maybe some virus escapes the mask and does get transmitted to the next person near you. And the theory he was talking about, and it's not just his theory, others have had this theory also, is that even if some virus is spread, it is less. We're preventing, maybe let's say 80% or 90% of the virus from getting on the other side of the mask, so that when the person encounters the virus, it's a smaller amount than without a mask. And the theory is then that then would create a less severe illness experience for that person.
Bob?
Thank you very much, Mr. Chairman. And thank you, Dan and Sue. These comments and questions are really for both of you. Definitely open-ended. I guess what I'm trying to maybe express a little bit is some of these frustrations or just disconnect that folks have. We see cases, we keep hearing about cases, and then in spite the chart goes up, the ramp is going up. But really hospitalizations and deaths are flat, at least for us here. So I guess, that it's easier for people to say, hey, well, what's really going on here? And, we've had this mask mandate for how long? And well, shouldn't that just be taking care of things? I mean, everyone's being careful. And again, I'm kind of speaking generalities. But I think if we had more of a focus on the hospitalizations and deaths, that might lessen the specter of fear. I just feel like the emotional piece you talked about, I think, is extremely important. It's becoming more important by the day. We all know that stress leads to disease, and people are stressed. And just like you said, and we've got to find some kind of a balance and know that there's a light at the end of the tunnel. So I'd love to hear more. I think there's more numbers that need to be dug into, and this is, what we probably need to demand of the state DHS. But what conditions are people actually dying from? You mentioned spore load, and this notion that, okay, if a healthy person just gets, a couple viral particles on, into their system, if you're a healthy person, your immune system's going to take care of that. If a healthy person is hit with just hundreds of thousands of viral particles, then yeah, your body has a lot more difficulty dealing with that. And I know that we won't be able to go case by case and death by death and say, oh, this person's initial contact with this viral contaminant, was 3 particles, or was 3 viruses, or was 500 million viruses. We don't. We won't know that. But I think we do need to start looking into and start publicizing what conditions people are actually dying from. We've got a lot of people who are dying because they have pre-existing conditions. Well, maybe those are the people we need to protect. Again, I guess we, ultimately we can't go on living for months and months and months under this specter of fear. So I'm hoping we can find some, and again, these are open-ended questions I'm not expecting an answer to. But I think we need more numbers from the state as far as digging into, some of these things, and then also more information about personal prevention, not just wearing a mask and washing your hands, but what about your diet? What about your exercise? How healthy are you? Let's get out and let's make sure you're more healthy. Make sure you're eating good food. And again, I hope we can get into somewhere down the line, sooner than later. Are these people that are dying actually truly healthy people? I think we have a false sense of what's healthy in America today. Obesity is out of control. We have heart issues. We're all stressed. We're eating food that's poisoned with chemicals. People aren't generally healthy, and so they're dying because COVID unmasks this underlying condition. And then we blame the COVID, and it's it's complicated, but I hope we can get into some more preventative type self-help, self-care type things, and a better understanding of what treatments and solutions, give us that light at the end of the tunnel. Anything we can do to address that emotional element and try to reduce the specter of fear that everybody's living under, because when we're living in a fearful way, fear drives a lot of really unhealthy and unsustainable behavior, both personally and as a society. And it's a really important factor about this whole issue. Thank you.
Any comments, Sue?
Not expected.
Okay. We'll go to Susan.
I just wanted to share a personal comment. My youngest son tested positive, and he's not a young man, he's 42. And he did not have symptoms he didn't. However, he lives in the state of Arkansas, and when he was finishing quarantining, he got a letter saying now he, could be off of quarantine, and he need a letter so I could read it. And I was really struck by this letter, which spent some time kind of giving him permission to go back to more normal. But it had a chunk of the letter that spoke about if you are an athlete, you should, before you go back into doing, working in your sport, you should go to your doctor and be checked out for these underlying conditions that some folks are getting, or if he was going to undertake strenuous exercise. So they felt it was significant to assume that just because you don't have a lot of symptoms doesn't necessarily mean, hopefully it means, but doesn't necessarily mean that you haven't gotten any damage. So I just shared that we have to take this serious for a lot of reasons. But I was totally surprised when I read the letter. And then the other thought was, I think the messaging that we have out there, what I've seen has been very good. Maybe we need to add a little piece to it about this idea that everybody's under stress, everybody's doing the best they can. Kindness, just letting people have the benefit of the doubt. I don't know how we want to do it, and maybe we have to think about that a little. But it might be something we could shift a little bit to get at some of them. But this could be a very long haul, and it'd be nice if we could get through it without screaming at each other.
Mm-hmm.
Vinny?
Thank you. So this is another angle of probably not having the answer, but just wanting to think about it from the county board perspective. And we don't have a way to predict how many more cases the department's going to have to do contact tracing with, but it looks like the trend is going up quite steep, especially in September. And the process of having more contact tracers, I guess I'm just trying to put out there, at what point do we either have more staff or reduce the emphasis of contact tracing in order for the department to be able to continue all of the other programs that are important to the community as well? And so that's probably a very hard question to address, but I just want to be sensitive to it that there's so many good things the health department does. And this is one of them that's very in high demand right now. But how do we, as an elected body, help support that work when it's changing so fast?
Alexis?
Thank you. I guess I have a question about Sue's comment to the kids getting sick and parents staying home. I don't know that Sue or Dan necessarily have the answer, but the federal or state programs for the expanded emergency sick leave and FMLA are due to run out middle of October and then at the end of the year. Do we know if there's any conversations to extend those programs, or if there's any local authority that we have to do more supplemental help for take some of that fear and anxiety out for parents? Thank you.
David?
Yeah, this question is directed at both Sue and Dan and anybody else that might be able to answer it or give some much to Supervisor Boltman asked relative or comment he made relative to underlying health and nature of our food in this country. We live in a healthcare system that is driven by insurance. It is not driven by the good of the public as a general statement. What I fail to see ever mentioned is ultimately the cost of providing these emergency services or basic medical attention that probably is not covered underneath insurance, or substantially is or not. Certainly, we don't hear about an individual that got out of the hospital after a 19-day stay in the emergency in the ICU and what their medical expenses are. We all know that you can't go to a medical facility without paying something in exchange for doing that. And in this country, it is insurance-based. It is not government-based as much of the world does. So my question is, and I haven't heard it, and I know it's going to come, and I certainly know somebody's telling me numbers somewhere. What is eventually going to be the dollar value concept, and how is it going to be paid for the services rendered at these various medical facilities that are not covered underneath any current designation of a COVID grant or some other related payment cycle? And I know I apologize right up front by saying that I recognize this is not the kind of question either one of you would probably be able to really answer, but it's going to come someday. So I'm just wondering if there's any hint of what's likely to come forward in the next year or two, 10 years.
So this is Dave. I have a tracing question for you. Last time we talked about caseloads that were coming from, tracing caseloads that were coming from out of state or out of county. That's still the bulk of the tracing requirements you're having, or is it shifted more to in-county tracing requirements?
So there has never been much of a workload related to visitors coming here as far as contact tracing. It's always been, and it is now, I would say less than 10% of our workload involves people from out of town. It's mostly Door County residents that we follow up with. There are some calls from other jurisdictions saying they have a case that was in Door County during their infectious period, and they let us know close contacts in Door County that we then follow up with. But that's minimal. I also, while I have the floor, if I could just comment on Vinny's question about when do we go to crisis standards. And I didn't mention that last week, I think it was last week, maybe it was the week before, the state DHS put out some guidelines for local health departments, crisis standards, how we should proceed with case follow-up and contact tracing now that we are all overloaded. And it's a 2-page document, and in reading it, we were already doing, 3/4 of it. And then as of this week, we began sending cases to the state. So we have employed those strategies. And to someone else's comment about unknowns in this, yeah, I think just the idea that there are, and all the questions about how severe our case is going to be and what are the long-term consequences, all of that, there are many unknowns, and that's part of what the fear is, I believe. If I had to say what the number one frustration and emotional response was from in our community at this point, it would be being advised that either themselves or their school-age child needs to quarantine for 14 days because they're not ill. And this is a huge ask. It's not easy for any of us to quarantine for 14 days. And certainly for young families whose parents work, it is a huge strain.
We have another question from Nissa.
Thank you. Sue, you've talked about this before, but I'm not sure if everyone knows vaccinations by public health have been, delayed and temporarily stopped. Do you have any idea yet when they will return? And can you let people know what the alternative is for people that can't go to public health to get their vaccinations? Because I'm sure there's a lot of people out there that don't know the answer to that.
Yeah, thanks for asking, Nissa. A few weeks back, we had a great plan to get our contact tracers up and running, the new folks, and that worked beautifully. And as they were up and running, we got this huge surge in cases, which caused us to have to change our plans. Ideally, we would have been giving immunizations by now. We will do the flu clinics, and I'm hoping that that can lead to us being able to have capacity to get up and running with our regular childhood immunization program. We refer folks to their healthcare providers. Door County Medical Center has continued to give immunizations, and as well as the Aurora Clinic. I'm not clear on what the local Bellin Clinic does with that, but if that's your healthcare provider, I would encourage you to ask there.
Any other questions?
Yeah, I do have a question, Chairman.
Please go ahead.
Yes. I just have a couple questions or comments on what I'm hearing and seeing for Sue Powers or just the general, even Dan Kane. With the schools systems of our districts being stressed out, and I've received some calls and from my healthcare professionals also, I feel that the county really should evaluate maybe where we're at and what we're doing. And I understand that things are changing. But I just thought I would put some comments out there on what I'm hearing. So I'm hearing the stats from professionals in the school district letting me know that, hey, there's nobody that's died under the age of 20 in Wisconsin. Letting me know that I put 1 week of school in, work in as a teacher, and I feel like it's been a month. They're extremely stressed out. There's classes that are getting shut down because they don't have staff. So the kids are healthy, but they don't have the staff. That the parents need their kids to go to school so they can work. But I guess my most concerning one is that I'm hearing that there's healthcare professionals that are active with COVID. They have had it tested positive, or they're active with COVID. And if they don't have symptoms, they can continue to work. But if a child at school has an active positive COVID test, they have to stay home for 2 weeks. And I think that this information is getting out in the community, and people are becoming very frustrated by that there's one standard for one group, but not for the other. But yet the youngest ones are least susceptible to get harmed from what we know as of today. And if our healthcare professionals are the ones taking care of our most vulnerable and our most elderly population, but yet their team feels it's okay with an active and no symptoms, they continue to work. I just feel like we have to somewhat address this, or maybe communicate that, or get ahead of that messaging somehow, if that's the direction we're going to continue to go. So that's what feedback I had, and some comments. And if you want to address it or talk to it, go ahead, or what questions may come out of that. Thank you.
Thank you, Laura, for bringing some of that up, because there are so many misconceptions in the community. I'll start with the healthcare worker. Anyone, whether it be a healthcare worker or anyone, if they are a positive case of COVID, if they are in their isolation period, they are not under any circumstances okay to work. I want to be very clear on that. So they would be a healthcare worker under the parameters of the state DHS is allowed to work if they're a close contact of a case and they have been asked or instructed to quarantine. If there are staffing shortages sufficient to affect the safety of the community and the healthcare institution, then they are allowed to work. To my knowledge, at this point, we have not in Door County have had any healthcare workers work when they've been under quarantine. There are also exceptions that we can make for people that we've instructed to quarantine if they work in a business that would, if they couldn't work, it would affect the safety of the community in some fashion. And that is a local determination made by the health officer, and we have made to date no exceptions in that realm. And then to talk about the kids at school, yes, you're correct, of course, that children are known to either have the least symptomatic of cases or at times be asymptomatic. But what we also know is that they then spread it to the more vulnerable population. And we also know that any congregate setting, such as a school, is going to be a place where the virus can spread more easily. So there are a little bit higher standards at the school for who needs to quarantine. No child is allowed to go to school if they're a positive case and they're still symptomatic and in their isolation period. They are never allowed at the school building. They may participate in virtual school from home, of course. So I'm not sure if that cleared any of that up. And I just have a comment in that we get so many questions. There are so many things spreading around. It's impossible to throw out guidelines in general because there are, as I just described, so many individual considerations. And, people learn a little bit about the guidelines and then get upset when we have to tell them something different, or when their neighbor or other parent hears or is instructed in some fashion differently. But that's the nature of it. There is not going to be any blanket guidelines that are all the same for everyone. Now, in general, you need to isolate for at least 10 days after your symptom onset if you're a positive case, and you have to have at least 24 hours of no fever and improving symptoms before you can be out of isolation. And in general, it's a full 14 days of quarantine. But as far as who is to quarantine and how they are to do that, that will vary.
Okay, thank you. We have another question. Tara?
Yeah, I just wanted to remind people that there was a Bayport teacher that passed away from COVID, and I think that we can't put people's lives at risk indiscriminately. And then I also wanted to emphasize, because I've been hearing a little bit of victim blaming, and I wanted to make sure that people don't blame people for their size or act like it's their fault if they get a disease, because I think that's dangerous to start doing. And I wanted to, it's easy to say that we have to get back to normal, but I've been reading that there's been a tracking of just the amount of deaths this year in comparison to last year. And there are a lot of deaths that are not being attributed to COVID that are still happening. And I just want to make sure we don't normalize the amount of deaths that are happening. So I know it's easy to say, like, we want to get kids back to school, we want to do this, but I think it's dangerous to just get back to normal for getting back to normal's sake. Thank you.
David, over.
Yeah, so you can talk about the infectious period and those quarantining for 10 or even 14 days. What about those that are in contact with that person with COVID virus? Because there seems to be here in the community that if it was 3 days ago, 5 days ago, then I don't have to quarantine. What's kind of the guidelines there?
Yeah. So, and people have misconceptions going back and forth. They fear that they should quarantine even though their contact with the person was a month away, a month back. Or they don't want to quarantine even if they were in contact with the person during their infectious period. So the infectious period begins 2 days before symptom onset. And that is one of the things that has promoted the spread of COVID. You feel fine, you have no idea that you could have COVID, and you're out doing your regular business and in contact with people and spreading COVID. So the infectious period begins 2 days prior to symptom onset and continues for the 10 days of the infectious, for the isolation period, rather. So as far as who are close contacts, there's parameters around that, and really briefly, within 6 feet of someone, whether or not you're wearing a mask or whether or not there's a little plexiglass partition between you, for a cumulative 15 minutes or more in a 24-hour period, or if you live in the same household or have stay overnight in a household, or if you have direct physical contact such as a hug. Those are all parameters for close contacts, and we would go back, depending when your last contact with the positive case was, and determine if you're a close contact or not. So we get all kinds of questions about this. People think they are a close contact, and they're really not, because they were not with the person during the infectious period. And we get the other concerns that they want to insist that they were not really a close contact. And we have to go by, we interview our case patient, and we really have to go by what they tell us, or in the case of a school, we ask, and we've put more responsibility for this on the schools and our businesses. We've had to ask for their cooperation and a little more responsibility in helping us know who those close contacts are. What does that classroom look like? Where are people really? Who was truly in the classroom with that case? And at businesses, who really worked side by side with that person, and maybe who didn't.
Any other questions for Sue? Sue, we have no more questions at the point. Do you have one more to Megan?
Just on that same kind of thought, Sue, would you be able, at least this is what David's question triggered for me is, would you be able to kind of work some out, say there was a close contact and you had been around someone who, you had had close contact with someone that was COVID positive, how long after or before you're testing negative would you want to stay out of public in that situation? Is there math around that you'd be able to share?
Thanks for asking, Megan. So the incubation period for COVID is a full 14 days. After contact with the infection, any time from about 2 days after until 14 days, that viral load can replicate enough to cause infection in you. And sometimes people don't have symptoms, but it could cause them to test positive or become symptomatic. So the quarantine, that's the rationale behind the 14-day quarantine period. And if you choose to get tested within that quarantine period, we would ask that you wait until between day 7 and 14, or at any point when you become symptomatic, we would ask you to get tested. But if the results come back before day 14, you are still required to remain within, the quarantine parameters until the full 14 days, even if you're negative.
Thank you, Sue. Dan, comment?
I do. Apologize. I just came across my wire. I don't mean to throw more confusion into this conversation than there already might be. But for those that might not be aware, the governor did just declare another emergency within the last hour and has extended the mask mandate. I don't have all the information right now. It just came out, like I said, but more to come on that.
Thanks, Dan. Any other questions?
One more question, Chairman.
Go ahead.
Yes, thank you. With the definition of close proximity, Sue, how did you look at defining that? I am aware that CDC kind of changed it, but from what I'm hearing and seeing and reading with my other jobs, close proximity is not defined the same as some other colleges, maybe the public schools here in Door County. But is that something you research and pool with other counties on? I've heard that other counties are doing some things a little bit differently. Just wanted your thoughts on that.
So, Laura, the definition of close contact is nothing that we determine. It's determined, we follow what the state has, and it's easy to find. It's on the DHS website. If you go to diagnosed and you go to what do I do if I'm a close contact, you'll get the whole parameter, and that's what we provide people. If other health departments or colleges are doing contact tracing and doing it differently, I am not sure about that. We work with the schools here and we provide that parameter, and we ask them to determine who in the school are the close contacts.
Okay, yeah, I'll just let you know. So close proximity, from what I'm seeing and hearing and reading, is that some are defining it as within the 6 feet without a face mask on or only a face shield within 15 minutes or more. So that's just so you know.
Any other questions? All right, thank you, Sue and Dan.
Okay, so the next item, since it's been brought up now, it's a good transition. We'll talk about the post, obviously the extension right now, but Grant has some information in regards to the Executive Order 82.
Yeah, as Dan indicated, and it was actually distributed earlier this morning, the governor did make another declaration of public health emergency and an emergency order relating to requiring face coverings that is now in effect through November 21st, 2020. From what I can see in a quick read, it is nearly identical to emergency order number 82 and emergency order number 1.
Okay. Resolution. Okay, moving along to resolutions. Resolution 2020-72, joint resolution naming October 2nd, 2020, Manufacturers Day in Sturgeon Bank in Door County, Wisconsin. Somebody please make the motion.
Mr. Chairman, I'll make a motion to approve resolution 2020-72.
Okay, thank you.
Sure. So this is actually working with both the city and obviously Door County Economic Development Corporation. They are working on, again, naming October 2nd as Manufacturing Day. So I work with Steve Jenkins, who is the executive director there, in putting together this resolution. Again, they're trying just to promote, obviously, manufacturing within Door County, since it plays a large part of our economy. And that's why it's before you here before. I know the city actually took us up on Tuesday and passed it on Tuesday night. Oh, no, last Tuesday, sorry. Tuesday today.
meeting Tuesday, so any questions, comments? Not by voice vote, all in favor? Aye. Opposed? Carried. Resolution 2020-73, renewal and revision of Wisconsin Bay Workforce Development Area Consortium Agreement.
Mr. Chairman, I'll make a motion to approve resolution 2020-73.
We have a motion. Is there a second? Second. Mr. Biss? Grant, do you want to explain that?
Sure, briefly. My situated here. The consortium agreement initially went into effect in 2012, was revised and extended in 2016, and it is due to be renewed in 2021. What is attached, addendum A, is the proposed agreement. Changes from the prior agreement are indicated in red print. There are 11 counties involved in the consortium that Door County is involved in, and based on my review, I have no legal problems with the agreement as drafted. The way the resolution is crafted the way it's crafted because we have 11 or 10 other county corporation councils that are looking at this and 10 other counties, and we need to have some ability to review the changes that come in and concur without bringing it back to the county board each time. So, and it's similar to the way we've extended the agreement in the past. In terms of the statewide situation, there are 11 workforce development areas in the state, so they're all going through similar things. I don't know if anybody has any questions specifically about it, or and it also relates in terms of the county's participation into what's called the Wheel Board.
Before I get to you, Bob, Biz is our Leo Board member. Would you like to make any comments about this?
Well, it's a very lengthy document, and Grant said what the changes are in red. Jim Golombowski is the head person for the workforce development in Green Bay for the 11 counties. And he's retiring and going to be gone after December 31st. And they've already working on a replacement person that's been there for 7 years with that department. I think Mr. Golombowski put out a signature page that's going to require a signature of the county board chairman. And I don't know how far they are with the other 10 counties. And did you get a copy of that, Mr. Chairman, of that page? With,
not yet. I would assume they probably won't get it until the counties agree.
So for the other 10. So Jim's trying to get them all together, and it's going to require all the 11 county board chairs to sign off on it. And it's in progress now, and Grant doesn't have a problem with any of the changes, so I'm sure, the Door County is going to pass it and then wait on to the others.
Thank you. Bob?
Thank you, Mr. Chairman. I was just hoping someone could give like a 10,000-foot view of what the Workforce Innovation and Opportunity Act is and what it does, and what this consortium, just a little bit more about what the consortium is about. And then specifically, because I read through it, and it's a lot of legalese because that's what this document happens to be. So it's not a welcome to and explain type document. So that's why I'm looking for a little bit more of that. I just want to understand a little bit more about what this, the reach of this, I guess. And I'm curious, obviously it's talking about workforce development, and I'm curious if since we're talking about 11 county area, what level of business would this potentially affect? Is this for, just large corporations, or is this possibly for people who are, starting businesses up and, more, I guess, what level does this, because I think this involves federal money ultimately, isn't that what I'm seeing here? Anyway, a lot of questions, but if someone could just kind of give a little overview. Thank you.
I I am going to be limited to the legalese because I was involved back in probably 2009, 2010, 2011 when this initially came up. But you're correct, Bob. It is a way to distribute federal assistance through the states. And one of the requirements of the act was to have these, what we've called Wisconsin, but they are statewide workforce development areas. The idea being that we wanted to, that the state should break down the consortiums to a county level, and quite frankly, I don't know how they reached having 11 workforce development areas, but that's what was agreed to. And the primary purpose in this, and it states in the first whereas paragraph, is to allow individuals, one, to authorize the expenditure of federal funds, streamline services through the statewide workforce investment systems to empower individuals, and the individuals is all encompassing. It includes persons and entities through information access to training resources, provide universal access to core career services, and increase accountability for results and ensure a strong role for local units of government, local governmental bodies, and the private sector and the workforce investment systems to facilitate state and local flexibility and improve youth programs. Now, I have not been involved in the nuts and bolts. I don't know how since 2012 that has manifested itself on the ground in the 11 counties that are involved in the workforce development area that the county is involved in. And I'm guessing that nobody in this room probably has a firm handle on that, maybe Biz as much as anybody because you've been on the local board. But what I might suggest is at some point in the future, and I suspect that our workforce, our WDA will be doing that when they get to new leadership. They will be taking that person around to the various counties and introducing themselves and explaining a little bit more about how this program works. But from a legal standpoint, it is a condition precedent to having access to these resources. So I wish I had a better explanation for you. I don't. And I could prattle on for another 20 minutes, but I won't.
Yes.
Well, thank you, Grant. You covered quite a bit of it. But there is a workforce development board, and the Leo board oversees that board. And it covers a lot. For instance, the job centers, we have one in Sturgeon Bay, Cherry Point involved. The job centers are under this. And also the dislocated workers and the youths, there's all kinds of different programs that are covered under this whole thing. And Grant's probably correct. When we get the new person on board on January 1, I probably will request that he come to Door County and give an overview of especially for all the new people. Golombowski was here a few years ago and gave a good overview, but of course the board has changed a lot since then, so we're going to need another one.
Yeah, thank you.
Okay, thank you very much, and I would definitely appreciate you extending that request to him, or when that for him or he or her, he or she, whenever that person is, settled in their job. I would love an overview. Thank you very much, both of you, for the explanation.
Sure. Thank you. Any other questions? If not by voice vote, all in favor?
Aye.
Opposed? Carried. Thank you. Resolution 2020-74, approval of lease agreements with Pitney Bowes for postage machines.
Make a motion to approve.
There's a second. A motion in a second. Explain. Yes.
The agreement is to renew our 5-year lease with Pitney Bowes for our postage machines at both the Justice Center and the Government Center. We have leased our machines for the past 10 years through Pitney Bowes. The cost of the lease actually will be reduced next year. So going down, we do get new equipment. As soon as we sign the lease, they will put the new equipment in, and the lease will start the beginning of December 31, January 1 area.
Questions? This one, we will go to the voter board. Let's pass on the vote of 21 yes, 0 nay. Thank you. Ordinances, the report, chapter 14 text amendment, i.e. cleanup. David.
Mr. Chairman, I make a motion to accept the report on chapter 14 text amendment.
I'll second that, Mr. Chairman.
Would you like to explain, Dave?
Basically, this is the report. I was going to give a better explanation at the actual resolution. It's related to the amendment that we made a couple months back in cleaning it up. Originally, there was an amendment. There was a line entry in there that exempted 15-foot towers of any type, any purpose, TV, satellite, ham radio. And inadvertently, when the amendment was added, that removed that item, and we wanted to make sure that got back in with something to give the average user 50-foot towers not having to go through the ordinance for.
So the report we can do by voice vote. The ordinances we'll have to do by the voter board. So on voice vote, all in favor of the report?
Aye.
Opposed? Carried. Ordinance 2020-08, chapter 14 text amendments. David.
Mr. Chairman, I make a motion to adopt 2020-8, chapter 14 text amendment as presented.
Mr. Chairman, I'll second that.
Again, this is related to those changes. I have a couple of notes. Because remember, chapter 14 is related to any tower. And this was going to just simply get rid of what was viewed as a hindrance for people that just simply wanted to put something like a TV antenna up or a antenna up, a tower up to be able to reach a satellite, direct to the dish network and so forth. And when we made that adapted version, that got removed, and we wanted to make sure it got back in. Steve.
Yeah. Questions? We'll go to the voter board. That's passed on the vote of 21 yes, 0 nay. Thank you. Ordinance 2020-09, amendment of chapter 11.05, Door County Code, all terrain vehicles and utility terrain vehicle routes. Right.
Thank you, Mr. Chairman. Yes, this ordinance is moved to approve this ordinance amendment.
I'll second that.
Little more information, Mr. Chairman. This is the two townships, two municipalities are asking for permission to use certain county roads for UTVs. And this enhances their route system is what it is. So every time a municipality comes and wants that, it goes before the highway committee and then it comes back to the county board and we just add that on. So it's adding on two more lengths of roads. And we will be publishing shortly, I hope, showing all of the county roads that have UTV trails on. And it would help us to see this when we have these amendments come before us. And I was told that we'll have that.
Good idea. David.
To that question statement, I do wish that when we do these, as we have done in the past, that we include a visual map for where these roads are. As many of us that have been here a little bit on the long side, the last one we did ended up being quite a long conversation because of misunderstanding of where it was intended to be going. So please, for every new one that we do this, please include a map that shows at least the section that is being added, and don't necessarily need to see the rest of the stuff we already approved. That seemed to muddy the water last time we did this. But I really, it's difficult to zoom in and find these roads sometimes and understand the intent of the road and its addition. Thank you.
Thanks, Dave. Susan.
Because of the nature of how we've added these, I think we sometimes get the boilerplate. And I want to call your attention to the fact that the first two paragraphs talk about the town of Bailey's Harbor. So I'm guessing that ought to say town of Gibraltar and town of Gardner, since that's where these two additions are. Am I right? Because we didn't propose any change for Bailey's Harbor today.
No, that's absolutely correct. The first two paragraphs actually would need to be revised to reflect the requests from the town of Gibraltar and the town of Gardner.
Do we need to make that an amendment then, or can we just do it?
I think you want to make that a friendly amendment.
Right, I will do that.
Okay, we also need a second to the amendment.
I'll second that.
You made the motion.
So, I'll grant the amended motion of priorities.
Yes.
Yes. So we will vote on the amendment, the friendly amendment, to put the correct townships in place.
You want to roll? You want to roll call?
Or ordinance.
Yeah, I'm waiting. Are you calling for the vote?
Yes. Sure. The amendment has passed 21 yes, 0.
I'm sorry, I didn't hear you make that request, Mr. Chairman.
Sorry. Okay, so the amendment has passed. So we'll go back to the remaining questions. Bob?
Thank you, Mr. Chairman. Yeah, I just would like to reiterate Mr. Engel's comments that visual is so important. We need a map. We need to see what we're talking about to kind of see not only the network, but just make sure it makes sense and to avoid the problems that we had the last time when we didn't have a map in front of us. And I'm just curious, Mr. Engelberg said there will be a map forthcoming. Is that, who makes the map? Is that who makes the map, I guess is the
I'm working, so what we're trying to do is we're trying to get a comprehensive map of both the town roads and also the county roads that are included within the network. So actually, I was directed by the highway committee to put that together, so my office is handling that. I'm having Lori reach out to every town chairman and clerk to see if we can get that information. We'll put together, I guess, a map this in-house with our internal GIS staff. But we are actually working then also with the Visitors Bureau to see if they'll willing to actually publish a map. Or I know they have an online system for the snowmobile routes that has a module that could also publish that. So we are in discussions with the Visitors Bureau as well.
Thank you.
Jenny?
Again, I won't keep saying the same thing, but the map is helpful. Just even for the ones that are proposed, even if it's before the whole entire map can be done. And if you can just review the process. So it starts with the municipality and then it goes to the highway departments to review things such as safety and connectivity. And then the highway department brings it here for the final approval. And I trust that whole system, but I guess it would be better to have a little bit more information just in general. Like there was no opposition. It met all the safety criteria, which I'm assuming, that it did if it's coming here, but we get that with all the other committees and reports for things that we have to approve. So it just seems like there's not a lot of information. Thank you.
Megan?
Thank you. I would appreciate that as well. Is there a way for us to, because I looked this up on my own earlier and I thought I knew what roads I was looking at, but I wouldn't mind that being confirmed. Is there a way for us to come back to this in 15, 20, 30 minutes down the agenda? And by that time have a map pulled up where it could at least be pointed out exactly where these trails are, since we have this concern right now? Okay, there's an map in there. Yes. Okay, is that something everyone would like to see? Can we pull that up on our screen?
Was it, Joe? It's on the highway agenda from.
So it exists already, we just need it included. If there's a way to access that for all of us, I think that would put us to rest.
They're trying in progress. Well, we're looking for it, Roy.
Thank you, Mr. Chair. Just one comment. Our highway commissioner, we asked the question about safety on our roads with UTVs and ATVs. And so far, since this has been established, we've had no accidents that we know of that we've had with those vehicles. In the future, something to think about, we might want to consider what our neighboring county did. The county passed an ordinance opening up all county roads to ATVs and UTVs. And that would require in our ordinance. And then secondly, the municipalities could open up their roads to ATVs and UTVs. And when that happened, the municipalities then, if they adopted the county ordinance, then the county law enforcement would do the law enforcement on all roads. That's something we might want to consider in the future. But from getting back to this ordinance, this one here is simply opening up in two more areas for the townships to be able to travel, and safety hasn't been a problem.
Thank you, Ryan.
Frank, you get the link. This is County Road F. Here's Maple Grove. We're talking about the area in red. And then the second one. And then here would be the location of the other one that was in the highway too. So no, that was Gardner. That's Gardner. But this is one. Yeah, that's both of them. Yeah. I'll scroll down one more time for the other map.
Excuse me, can I speak out of turn? Number 4 is wrong, because if you notice, Fox Lane is off of County C. It doesn't have anything to do with County N.
It goes past County N. It goes to County N.
County N and Fox Lane has nothing in common.
Yeah, but it's that little curtain.
County C, but not County N.
Oh. County C from County N to Riley's Bay Road.
That I'm not talking about. I'm talking about County N from Fox Lane southerly to down Gardner County Road. But that's
David?
Yeah, Nancy's correct. That was something I just questioned her before the maps came up, because Fox Lane intersects County C. And there's about a half mile before you get to County N as you go southerly on that map. So it's just a correction to item A, number 4, the last sentence is wrong on the existing roads. You need a map for the town gardens.
Ordinances before.
Oh, that's from a previous ordinance.
That's a previous.
Right, that's like 3 or 4 ordinances before.
And maybe if I may interject, when we have the map showing all the routes, we can have the highway department check to make sure the written descriptions in the ordinance are correct and make any corrections and bring it back. If it needs to be amended further.
Megan, does that answer your question?
Yeah, it does. Thank you so much. I have requested again, I can ask that question right now, or I can wait my turn. I have a different question.
David, Annabelle?
Apparently I drive in different areas and seem to always have different opinions on the experience of the public. I drive in many counties where these are allowed, and I don't paint as nice a picture interacting with ATVs, UTVs on the road as Supervisor Engelbert does. So just keep that in mind. They are a different kind of vehicle. There are a wide variety of individuals that, in my experience, many times shouldn't be on the road in a car, and have an attitude that tends to be, I have the right to be here and I will not move over for you like I'm supposed to. And because we are an area that involves tourism, if we start to publicize these routes, people will come up and use them as UTV routes like they do in northern Wisconsin, which are definitely roads that are not driven routinely. They're also typically old snowmobile trail in the wintertime. And it is, you know, people that I have experienced where they're in these environments, I feel a lot of farmers, a lot of orchard people that certainly respect the use of the vehicles on the road, but then again have the right to go in. So it is not as pretty out there just because the accidents and the bad actors are not reported to the sheriff's department, or the sheriff's department does not report it, does not mean it's not happening. Thank you.
Megan?
Thank you. Grant, would you be able to expound on what our legal responsibilities and ramifications are around whether or not an injury or death would happen?
In brief, yes, the counties are afforded various immunities and limitations on liabilities, and it's unless we don't do our due diligence and don't at least exercise discretion. As long as we exercise judgment and discretion, and even if we're wrong, we're not going to be liable. It's when you violate a ministerial duty or act recklessly that counties can get themselves into trouble. And kind of take a step back, when we initially came up with this process, which is authorized by statute, the decision the county board made, and it is a decision for the county board, not for staff, was that we were going to evaluate these requests on a case-by-case basis, because the feeling was that it wasn't appropriate to have ATVs and UTVs that actually operate on each and every county road, and that where the way the statutory scheme contemplates is that if a municipality, a town specifically, or I suppose it could be a village or even the city, wants a county road that goes through the town to be an ATV, UTV route, they have to request that the county do that, and it's not automatic. So I guess that goes to some of our liability protections also, because we do have a process where this is reviewed by the county highway commissioner, who goes through in our county, the airport, highway and airport committee, and then the county board for consideration. So in terms of liability on the county's part, I feel reasonably certain that we aren't exposed to liability because of the way that we set up the decision-making process, that we actually are taking some time to look at these and exercising judgment and discretion, and that allows us to fall under discretionary act immunity, which would immunize the county from liability in most cases.
Yes.
Thank you, Mr. Chairman. I'm sure everyone has gone up Maple Street and looked at the ATVs there at May Sports Center, and they're making them larger and larger, where they're 2-person and 4-person back seats. Some of these are almost as large as our smallest cars. And I can tell you, I have a newer one that I bought. It's just a smaller 4-wheeler, but they have good headlights, tail lights, brake lights, side reflectors, everything almost that is necessary, to operate on a road so that you're visible and people can see you. So I think you're going to see more and more of allowing these to operate on county trunk roads and even municipal roads.
David? Dave?
No. If we, I'm going to ask that if we do any publication, and it sounds like we're going to. My understanding of this and the state statute is it's for ATVs and UTVs. The devices, for lack of a better term, because they look like it when called golf carts, but they certainly aren't golf carts anymore. They are large, raised up and so forth, using campgrounds a lot. Can we make sure that if they are, if I'm correct and the law does not allow for those to fit under this, that we have the documentation included, some note implying that they are not included in this allowance, this map? Because that, I see a lot of that, especially in the Carlsville area, over in the Village and Town area, Big Harbor already, which of course is a simple violation. Yeah. It'd be helpful to have that information on that. And whatever we do.
I just wanted to say there's just that same kind of sentiment that there's like an overall plan. There's such a limited amount of roads anyway, but we keep getting sections requested piece by piece. So, and I guess that's up to the municipality how much, but it's just to that same point, to see them all in one consecutive network. Is the goal to piece by piece have them all open, or is it to have a route from point A to point B? Is it to market to users that this is a place you can use them to get from town to town? It just seems like as they keep getting added piece by piece, we might be losing the overall objective and just seeing what that would be. And I'm not making a judgment on it being good or bad one way or the other, but just think maybe we're at the point as we keep approving more to have that big picture in mind. And then I think to clear up some confusion for the public as what is allowed by law, what age is allowed to drive them on the road by law, and kind of the pieces and parts that go with that. So it's more comprehensive. Thank you.
Joel?
Yeah, just to comment on all of this. This is, I think, as it came out of the highway committee about making the pamphlets and brochures on this, I think that is a very important step that is going to be done. But to answer both questions that Vinny just had, the laws and the rules are explicit on the DNR, their UTVs and their ATVs. The rules and the regulations are explicit, set by the state on the DOT, the DNR websites on who can, what can, and all that stuff that can be on the roadways. And as far as the, how it's being published right now, it is piece by piece. That's how this was intended. When this came about 5 years ago or 6 years ago or 4 years ago when we started this, it was to allow the municipalities to open up roadways in their townships and then have the connector routes to come forward to the county to connect the municipalities to drive. So how it was intended is exactly how we are doing it right now today. That was the plan all along. Whether or not every county road ever gets opened up, I doubt it. I would never support that. And that's coming right from driving on county roads and recommendations from the commissioner in the past. There are just some county roads that should never have ATVs and UTVs on them. So I don't think that's ever going to get to that point. But as far as municipalities, they can do what they want to do, and they have the connector routes. They obviously have to come to the county to make the links between the different municipalities in the peninsula. So how this was talked about and discussed years ago is exactly what's happening right now, case by case. So.
Yeah, I would point out it's not unsimilar to the snowmobile route that is put together throughout the county. Okay, no more questions. We will go to the voter board. Let's pass on a vote of 20 yes, 1 nay. Thank you. New business, travel, training, attendance, and per diem.
Okay, so I've been just getting a lot of questions, so I just wanted to say it to everyone, so that we're being consistent. So obviously, we're not doing the traditional WCA annual conference, but WCA did set up what they're calling their virtual conference. So obviously, they published their training sessions, which are on those Mondays. For each one of those sessions, if you'd like, we're going to have this room set up so you can come here and attend. Or if you'd like, you could still attend on your own virtually, at home or wherever you'd like to attend that session. Again, for the WCA training sessions or the virtual sessions, those are $50 for the first hour. Most of them are already all set up to be this 1 hour session, but if something would, I guess, go beyond, you follow your regular rules in terms of the increments as far as your time, as far as claiming your time. So that covers WCA. The other question that we're getting is, I want to attend a training session on this or another item. So the question I was talking with David in terms of how do we want to handle that? I guess in talking with David, what he would like you to do, if you have a training session that you would like to attend that thinks helps you in your position as a supervisor, send David an email for documentation. Assume that you do not hear back that it's approved, and you sign up and you place that on your voucher for reimbursement, based off the time you attend. For trainings that's outside of WCA annual conference, those are $25 an hour. So there's a difference. So I have to make sure we're all on the same page. So it's $50 for the sessions that are on the Mondays coming up for the WCA training. But any other training that you sign up for or meetings that you attend would be the standard $25 an hour. And again, we'd ask that you just send an email to Dave, just because there might be a whole series of emails he'll review, but we're not going to do a response back on each one. Assume that's approved. If you think that's way out of line, he'll contact you and ask you questions. Correct? Yes. But that's how we'd like to handle that. And again, when you submit that, that'll come in and we'll just review that and we'll process that training for you. Are there any questions on any of that as far as travel or trainings that you'd like to attend, just so we're all on the same page of how to do that? Just because I got a lot of questions from different committees and stuff like that, and things are starting to pick up within all the different committee areas as far as virtual trainings. So that's how we wanted to handle that.
Yes, quick question. Just the code that I'm trying to put in for like the next virtual, it still asks for a code. So what code do you put in for the convention one?
Use the date. So
just the date.
Like 9/28 would be September 28th.
Okay, thanks.
And it can be more than a 3-digit code. So each October, November, it'll be more.
Okay.
So then you're saying all the virtual WCA ones on Mondays, and I think if they're all from 9 to 10,
right?
And you're going to set it up in this room.
Correct. Okay. They'll be set up here for those that don't have good connections. I'd like to come here. You can attend here, or again, if you'd like to attend from home or library or work, you can do it from there as well.
Let me ask a question.
Okay. That's all I have for that. That's what I'm saying.
Okay. Any oral committee reports?
If you don't mind, I'd like to just give one oral committee report. We did have our finance committee yesterday, and we did discuss our annual audit. For those of you that are love numbers, that audit is included in the packet. I guess just the one thing that was reported in the finance committee, just asked that I give an update, is that the audit itself shows that we are in a very strong financial position. They did not have any, recommendations or any red flags, which is always a good thing to have in terms of an audit done in your county. But again, this in terms of our financial position, they consider it strong. They consider it strong in terms of our undesignated balance. And they did not have any specific, anything identified in terms of major improvements of our operations or procedures. So again, if there's any questions, the audit is in our, the finance packet. And if you do have any questions, feel free to reach out to either Steve or myself, and we'll try to get you that answer.
Any review of any committee minutes that anybody would like? Review of vouchers, claims, and bills. Now announcements. The next Greenwood County Board meeting is scheduled for October 27th, 2020 at 9 a.m. Meeting per diem code for today is 922.
That being said, Mr. Chairman, if there's no further business to be transacted, I'd like to make a motion to adjourn.
Second.
All in favor?
Aye.
Opposed? We're adjourned. Thank you, everyone.